Thank you, Sages, for this opportunity. My name is Luis Pina. I'm one of the four-year residents at Geisinger Medical Center, and I'll be presenting rates of recurrent marginal ulcer in gastric bypass patients who underwent revisional surgery. We have nothing to disclose. Since 2014, bariatric revisional procedures have been the third most common bariatric surgery performed in the country. And marginal ulcer is a very well-known complication of gastric bypass, reported in the literature to occur in 0.6 to 16% of all patients. And about 1% of all patients who underwent gastric bypass will eventually undergo a revisional procedure to address marginal ulcer. So the question becomes, does revisional surgery provide an overall lower recurrence rate of marginal ulcer when you compare to the incidence of marginal ulcer after index operation? And does the procedure, does the approach matter? So we did a retrospective study. We examined data via chart review from a single tertiary academic medical center. We included all patients who had primary gastric bypass done at our institution and subsequently had a gastric jejunostomy revision or a Graham patch for marginal ulcer between the years of 2003 and 2020. And all those who opted for a gastric bypass reversal were excluded from the study. So our primary outcome initially was overall rate of recurrent marginal ulcer after the revision. So we also looked at recurrence rate of marginal ulcer after GJ revision, Graham patch, and also those who had bilateral truncal vagotomy and those who did not have bilateral truncal vagotomy. So this is how we divide our group. So we included a total of 99 patients to our entire cohort. 90 of those had a GJ revision performed, and 9 had Graham patch. Of those who had GJ revision, 35 of them had a bilateral truncal vagotomy at the time of the revision, and 55 did not have truncal vagotomy. Our median follow-up post-revision was 4.6 years, and within the first year after revision, we were able to follow up about 90% of those patients. And roughly 64% of the patients had at least one endoscopy after their revisional procedure. So looking at the entire cohort of 99 patients, we observed a recurrence rate of 20% of marginal ulcer after the revision. Looking at only those who had truncal vagotomy, the recurrence rate was about 14%. And those that did not have the truncal vagotomy, the recurrence rate was about 23.4%. So we went ahead and compared both of these groups with and without the truncal vagotomy, and we saw that the difference was not significant, as we can see here from this p-value. So subsequently, we analyzed only those who had the GJ revision because we were very interested in that group specifically. So we had a total of 90 patients, and of the entire cohort of GJ revision, we saw that we had a recurrence rate of marginal ulcer of 16.7%. And then when we analyzed the subgroups, so in those that had truncal vagotomy, the recurrence rate was 14.3% compared to about 18% in those that did not have truncal vagotomy. And when we compared both these groups again, we saw that the difference was, again, not significant. And for the Graham patch, we had a total of 9 patients, and 5 of them had recurrent ulcer after the revision procedure. So in summary, the overall rate that we found in our institution was about 20% of the entire cohort. And in those who had vagotomy at the time of the revision, we saw a recurrence rate of 14% compared to 23 without vagotomy, and the difference was not significant. When looking at only the GJ revision, the rate of recurrent marginal ulcer was 16.7%. And again, looking at the group with bilateral truncal vagotomy at the time of the revision, the recurrent rate was 14.3% compared to 18.2% without truncal vagotomy, and the difference, again, not significant. And Graham patch, about 56% of those had recurrent ulcer after the procedure. So let's talk about limitations of the study. So one, it's a retrospective single institution. Sample. This was our main limitation, as power calculation demonstrated that we would need approximately 300 patients to demonstrate some statistical significance, and we only had 99 of those patients. And another one would be follow-up, as not all all patients had an endoscopy after the revision, as we do not routinely order endoscopy in our patients after revision unless they come with any symptoms that would warrant any workup. So in conclusion, the rates of recurrent marginal ulcer after revisional procedure is pretty high, and adding bilateral truncal vagotomy at the time of GJ revision demonstrated a trend towards a lower recurrence rate. However, we did not see statistical significance, but mainly due to underpower, as we would need approximately 300 patients for sufficient power to reach significant, assuming that the observed trend was valid. Thank you, and I will take any questions.